patient's got immune-mediated inflammatory diseases, stomatitis, and fasciitis.
What do you want us to do about that?
It's a medical mystery, Sherlock. Why the hell else am I paying you?
Well, it might be due to an allergic reaction or something of that sort.
Or perhaps it could be a case of autoimmune disease?
I'm thinking more along the lines of an infection, maybe from some contaminated water they were drinking.
Guys, I think we're barking up the wrong tree here. This is clearly infectious diseases. Athletes, let's all do hypophycectomy. What?
No one. Fine. Just remember that you'll have to perform this risky procedure on the patient. And don't come crying to me when things go south.
Well, Hawks, I must say that your decision to perform hypophycectomy on your patient who you believe has infectious diseases is quite interesting.
I know it might sound unconventional, but I thought if anyone could pull it off, it'd be me.
And where exactly did you get the idea for this, may I ask?
Yes. It was from a subreddit called, AmItheDoctor.
There's no better place to learn about medical procedures than among the clearly experienced and qualified individuals over there.
I'm afraid that's quite reckless, Hawks. You're not just any doctor, you know. And infectious diseases are not something one should take lightly.
Well, I did some research on it online, and it seemed like the best course of action at the time.
It is highly irresponsible to base a decision like this off of internet forums and amateur opinions. As your boss, I implore you to reconsider.
Okay, and you go to that thread and tell everyone. I'll be watching you get downvoted into oblivion and laughing my ass off because no one knows what it's actually for.
You are a terminally online cretin?
Oh my God, we have to do something immediately. Everything has gone south.
That isn't good. I'm not dressed to head down there to straighten things out.
You tool. The patient's condition is critical, and I think we made a grave mistake by performing the hypophycectomy.
I know. It was a reckless decision on Dr. Hawks's part. But hey, you can't expect him to be perfect all the time.
That doesn't make it right, Frank. We have to correct this now or risk losing our patient.
All right, Randall, I see your point. So what do we do? Should we administer an alternative treatment?
The best course of action would be to consult with other medical professionals and find out the right treatment for infectious diseases in athletes.
What other medical professionals?
Not at this hospital, that's for sure.
What in the world were you people thinking? You nearly killed that patient.
But, Hawks,
No buts. Infectious diseases are a misdiagnosis. Hypophycectomy is not the right treatment.
what do you think the diagnosis actually is then?
We can't be sure of that without more information.
Agreed, Frank. We need to reassess the patient's condition before making any further conclusions.
Oh, so now you're gonna listen. Just like I thought, you were all just as blind as each other. You'll never make a good diagnostic team if you don't learn from your mistakes.
We are sorry for our mistake, Hawks. It won't happen again.
No, it will. It always does. So, how are things going in oncology these days, buddy?
Oh, you know, same old story. It's a tough department, but we're making progress. You've got some interesting cases coming through too, I hear.
Oh yeah, care to share more about that?
Well, there's this one patient in particular who's been giving us all kinds of headaches. She's been resisting treatment and is causing quite the stir.
Maybe it's because of your boring voice trying to say something exciting like, I'm sorry, dear patient. Hope you have your life insurance in order.
I never talk like that.
Try it. It'll make the world a more interesting place. Anyway, gotta go see what's wrong with my patient. You're all looking at me like I just committed a felony by walking into an operating room without proper gear. But let me tell you, when it comes to my work, there's no such thing as too much or not enough.
Hawks, you walked in here naked for 5 seconds, then walked back out without saying a word before you put your clothes back on. How else are we supposed to react to that?
That didn't happen.
Leslie's right, Hawks. We need to be careful. Our lives are at stake every day.
And what about the patients? They deserve a doctor who takes their safety seriously.
Listen up, everyone. The name of that disease was wrong. It's not infectious diseases athletes. It's ganglion deficiency.
What makes you think so, Hawks?
I solved it during lunchtime, Doc.
And how do you know the prognosis for this new diagnosis?
That'd be important to know.
The prognosis. It's not good. They'll struggle with their health and abilities throughout life.
That's tough on them. And us trying to help.
We're not trying to help them. We're not the ones behind the fast food counter fearing we don't have enough fries in the freezer. You're right, I should have trusted my instincts more.
I appreciate your willingness to admit your mistake, but that doesn't excuse the fact that you almost cost a patient their life.
I know, and for that, I am truly sorry. It won't happen again, I promise.
No, it will. It always will.